Hi guys, how are you? Welcome to another video. Today we are talking about acid reflux. Some people call it heartburn, some people call it acid reflux. Another name for it is gastroesophageal reflux disease. And most of us get it once in a while. That's okay to get it once in a while. But other times it becomes chronic where it causes problems to you. You're using over the counter medication, it's not helping you, and it becomes more chronic. But if you get it once in a while, you ate late and it's hard for you to sleep, those are usually manageable acid reflux symptoms, or what most people call heartburn. And the only way I could explain it, it's a condition in which the acid reflux kind of regurgitates. You find it coming back up. Most people will explain to you that I was laying down in bed and I felt food contents come back up at the back of my throat. That's the simplest way I could put it. It persistently leaks back into the esophagus, which is the tube that comes from your stomach to your throat. That's your esophagus. It's right here. And when this acid comes back, most people feel uncomfortable. If it's a temporary one, they're usually just a few days. But if you have those symptoms 2 or 3 days a week, that one we call it chronic acid reflux. And that's the other name is GAD, gastroesophageal reflux disease, which is a bothersome disease to many people. If you take Tums and that goes away, then you have the simple one. And then there are people who have to take a medication that suppresses those symptoms on a daily basis. So in the morning, they wake up and they take whatever the medication the doctor has given you. If it's omeprazole, if it is Protonix, if it is Pepsid, if it is Zantac, whatever kind of medication you've given you, your doctor has ordered you to take one pill when you wake up in the morning, and that kind of controls your symptoms for the whole day. That's chronic reflux symptoms. Daily pill suppresses the symptoms. You don't feel the discomfort. It happens because there's a valve at the end of your esophagus, the lower sphincter is what we call it, that it doesn't close properly. So when food arrives in your stomach, the acid washes back up, and that's why you feel those uncomfortable symptoms. That's how it works for most people. It happens to few people here and there, but there are people who deal with it chronically, and those are the ones I talked about, that they have to take a pill every day, every morning, to suppress the symptoms, because the symptoms can be quite debilitating for most people. And if you don't control them, then they go to a worse thing called Barrett's esophagitis. So it is better to control them while they are still reflux symptoms. Relieve your symptoms. Eat early before you sleep. 2 hours, really. They'd recommend they eat 3 to 2 hours early before they sleep. The main symptoms of reflux or acid regurgitation, heartburn. You feel like food is stuck in your throat. Some people can't swallow right. Some people feel like they're choking. It can cause a dry cough. People who wake up with a dry cough. So you feel like you're choking, food at the back of your throat. Some people feel like there's food coming up, especially if they sleep. They eat food and then go straight to bed. They're unable to sleep because they feel like the food is regurgitating. That's the main symptom for most people. Cough is rare, but there are people who get coughs, and then difficulty swallowing is rare, but there are a lot of people who get it too. You say, what is heartburn? What is the difference? What is heartburn? What is reflux? Heartburn is a symptom of acid reflux. It's a painful burning sensation in the middle of your chest, which is the esophagus, and it's because of irritation. Irritation from that acid in the stomach. So that is what is called heartburn. But heartburn fortunately can be treated with over-the-counter medications. Tums. There are people who will take Tums when they have heartburn, and then the heartburn goes away completely. Over-the-counter is Prilosec. That's the most common. I've seen Pepsid AC over-the-counter, and then Tums. Tums is the most common. You can take it, you chew on it, and it suppresses your symptoms for a little bit. If you need stronger one, then that's the acid reflux. That's the chronic acid reflux. So we'll talk about the chronic acid reflux. As I said before, it happens more than once in a while. Heartburn is once in a while. Go take your Tums, it's gone. Acid reflux is chronic acid reflux. You have to take a pill every morning. Otherwise, the tissue eventually becomes damaged. This tissue here eventually becomes damaged. So it is important that you take that pill because it suppresses the acid, and then you don't get that acid coming up, and that way you can eat without having those terrible symptoms that GERD usually causes, If you have the over-the-counter one, it's controlled, that's okay. But if you're having symptoms more than 2 to 3 times a week, it's important that you talk to your provider, whoever you see, MD, NP, physician assistant, DO, whoever the doctor is that you see, or you call your PCP. You need to talk to them and then discuss with them and see what your options are. Do you want to be on a long-term medication that you take every day for a few months and then it goes away, you trial taking food without it? Or do you want to take over-the-counter medications? If you're taking over-the-counter, that's not chronic. It has to be chronic for you to take a pill every day. If you're taking over-the-counter, that's just the one everybody has once in a while. Oh, I have heartburn, that's once in a while. But chronic acid reflux, which is gastroesophageal reflux disease, this one is debilitating. Most people will have to take a pill once a day. Some people do it for 2 months and it cures it, and then they know what to do to avoid the symptoms. The people who are more likely to have it is pregnant people. If you're overweight or obese, you're more likely to have it. Smoking, or you're regularly exposed to secondhand smoke. Then there are also medications that cause acid reflux. Those are the people who are more likely to have it in most cases. What causes acid reflux? Lower esophageal sphincter, that valve doesn't close properly, and then food regurgitates to the top, and that acidic food then irritates the esophagus, and that's what causes your symptoms. Sometimes too much pressure on the abdomen. Women experience heartburn more than men do. So avoid too much pressure on the stomach. There are foods also that cause it. Spicy foods, fried foods. Some people, late eating will cause them to have it. Medications such as asthma medications, blood pressure medications, some painkillers like non-steroidal anti-inflammatories like ibuprofen, and some antidepressants can cause it too. So it's a tough one to have. I've watched a friend go through it. It's really uncomfortable. For the ones who know what to do with it, they eat early, they avoid spicy foods, they sit up 2 to 3 hours before bedtime to avoid the symptoms coming up. Some people will do that without medication, and that does the trick for them. And that way, they don't have to go through the symptoms because they've learned preventative measures to use to control it without taking medications. If you're one of those people, kudos to you. And then there are other people, as I said, have to take the medication. What are symptoms of gastroesophageal reflux disease? Heartburn, problem swallowing, vomiting, sore throat, hoarseness, cough in some people. The feeling of food is caught in your throat. And then that regurgitation, food is coming back up. That's what regurgitation means. And then, what else? I think I've mentioned all of them. Those are the main ones. How do you know if you're having heartburn? How do you know is what most people ask. Will you think it's heartburn? Will you think it's chest pain? That's the difference. Some people will think they're having chest pain and yet it's heartburn symptoms. So it's important to differentiate the symptoms of a heart attack and the symptoms of heartburn. They're quite different. Heartburn is uncomfortable, burning feeling, pain in your chest, moving up in the esophagus, neck, throat. Heart attack is mainly pain, one arm, neck, jaw, back, shortness of breath, dizziness, extreme fatigue, feeling nauseous, or sweating. They just start sweating. That's one of the few symptoms for heart attack in comparison to chronic reflux. If your heartburn medications don't work or help your chest pain, then call for medical attention, because then that's heart attack. It's not reflux. Reflux is easily treated. You don't get the diaphoresis, which is the sweating. You don't get the arm pain in one side. You don't get the feeling of an elephant is sitting on your chest. Some people ask, can chronic acid reflux cause asthma? It's interesting because more than 75% of people who have asthma do have reflux symptoms, and then there are people who have asthma, a few percentage that don't have it, but most people with asthma do have reflux symptoms, but they do control it with the medication. If you don't control it, it damages the lining, and that gives you a worse case, which is Barrett's esophagitis, which is a different topic I won't go into, but because most people, if you get it, if you know what it is, most people are able to treat gastroesophageal reflux disease. There are ways we can avoid it. Keep a good weight. Avoid eating late. If you are one of the people that have spicy foods, fried foods bother you, then avoid that. Coffee is an irritant to some people who have the reflux symptoms. So as much as you'd like your coffee, it would be good to avoid those. Can chronic acid reflux become life-threatening? Yes, I have seen it in the hospital after they have surgery. So that is, now you had the reflux, the regular reflux. It was uncontrolled. So then it became Barrett's esophagitis. And then Barrett's, if uncontrolled, unfortunately becomes esophageal cancer. And so what happens is they give this a break, give you something we call a G-tube, so that you can rest this so that this can heal. But the chances of healing from esophageal cancer are quite little. There are people who heal, but chances are quite slim. So I'll talk about the four of them. Esophagitis, 1, Barrett's, esophageal cancer, and then strictures. So esophagitis is irritation, as I keep repeating, because mainly it is irritation of the esophagus, inflammation, stomach acid, causing the lining of the esophagus to be irritated. That's esophagitis. It can cause ulcers to most people, chest pain, bleeding, hopefully not, trouble swallowing. That's what esophagitis is. And then you come to Barrett's esophagus, condition in which it has developed over years. You've had this reflux, it hasn't been treated, so over time the reflux now becomes Barrett's esophagitis. So it's easier to control it than it becoming Barrett's, because Barrett's is now, the damage of the acid reflux over the years causes the lining of the esophagus to be that irritated, and that's Barrett's esophagitis, which is a risk for cancer. And the type of cancer is the esophageal cancer. So it is easier to control it while it's still heartburn. If worse, then control it while it's gastroesophageal reflux disease. But once it gets to Barrett's esophagus, it's a little bit harder to control. It still can be controlled to where it doesn't go to esophageal cancer, but it's a little harder. So control it while it's still heartburn or reflux symptoms. But once it starts going down, it's a painful disease. Esophageal cancer is a result of Barrett's esophagus. It usually develops in the lower part of the esophagus, develops from Barrett's esophagus, and this cancer is hard to treat because it affects the middle and the upper, the side. The way they can help treat it is sometimes they start that G-tube on you to give this a break. So you don't have any food you're swallowing or anything that's irritating. That's another way. But by the time you get to surgery, I hope you'd have controlled it at while it's still heartburn or reflux, instead of us getting to Barrett's. Once you get to Barrett's, it's a slippery slope. You're almost getting to the esophageal cancer. But it's good to control it while it's still heartburn and reflux. And then you have strictures. This is damaged lining of the esophagus. It's become scarred, causing narrowing of the esophagus. The strictures can interfere with the eating and drinking or preventing food and liquid from reaching the stomach. I have seen people who go for the stricture to be expanded every 6 months. When they start feeling it closing up, then they go to the hospital. They have a procedure. that expands it, and you can have it every 6 months, and that way you're able to swallow food without any difficulty. So would hope that we don't get there. You treat it while it's heartburn, treat it while it's reflux before you get to strictures, esophageal cancer, or Barrett's. So that's the main basics of gastroesophageal reflux disease. So how do they diagnose it? Most patients know what it is, so they can diagnose it from you telling your doctor the symptoms that you're having, and that's how they diagnose it. Other people will have to go for what we call an upper endoscopy. They put a tube, they'll numb you, they'll put a tube and then look inside and see how the lining of your stomach looks like, or the upper GI tract, and see the esophagus and the duodenum, how it looks like. Is it irritated? Is it bleeding? Is it, worse than they thought it was? If you cannot control, if just by telling your doctor, these are the symptoms I'm having, then if you're having those difficulty, they'll do that test. But most of them are able to control just from telling your doctor what is going on with you. We'd hope you'd control it before you get that far. It is very difficult to control. So if you have GERD, what are the things that you can do to minimize the symptoms? Avoid fried and fatty foods, peppermint for some people, chocolate, tomato products. There are people who the tomato products just irritates them, that it causes the reflux symptoms to get worse. Avoid drinking alcohol if possible. Avoid smoking. Avoid sodas. NSAIDs. I talked about NSAIDs. NSAIDs are non-steroidal anti-inflammatories. Aleve, naproxen, ibuprofen. Those are all over the counter. Avoid that because it will cause the inflammation to be worse. Eat small amounts. That helps some people reduce the symptoms. Do not overeat. If you smoke, if you can quit smoking, that will help your symptoms. Do not drink a lot of alcohol because this is one of the triggers for the reflux symptoms. If you're overweight, try and lose weight. And another thing is, don't avoid tight clothes around your belly because for some people that causes the pain to worsen. Eat early. Always eat early, 2 to 3 hours. I'll repeat that, 2 to 3 hours before bedtime. So those are the main ones. There are many medications that you can control. We have the antacids. Those are the over-the-counter. Tums, Rolaids, Mylanta. What's another one? Yeah, Mylanta, Tums, and Rolaids. Those are over-the-counter. Easy. You can go in, walk in, take. You probably will be able to do that when it's still heartburn. And then you have other group of medications called H2 receptor blockers. They decrease the acid production. Pepcid, Zantac, you can get those. Those are also over the counter. And then you have the proton pump inhibitors, which I was talking about. These are the ones you take once a day. Prilosec, Nexium, Protonix. Prilosec is over the counter. Protonix has to be prescribed. Nexium has to be prescribed, and then Dexilant has to be prescribed. So once a day, sorry about that. Once a day, take one, controls your systems all day. Those are the main groups. So I'd hope that you would have that and you wouldn't have to go through all the symptoms we're talking about and then getting yourself to Barrett's or getting yourself to esophageal cancer or having a stricture. Even the stricture is uncomfortable because going in every 6 months for it to be dilated so that you can swallow, probably not. So I'd hope that you would control it. It is common. It happens to all of us, but then there are those who have symptoms more times than others. Those need controlling. You guys have a great week, and I will see you next week. Bye-bye.